So your prescriber wrote you a script for Gabapentin and you want to start feeling better, but they didn't really explain to you anything about the medication and you're feeling nervous about taking it. Well, today we're going to review 5 must-know facts about this medication so that you can be better informed when deciding whether or not to start it. So before we even get into the 5 must-know facts, I need to real quick cover something that pops up all the time in clinic and is super confusing to a lot of patients. And that's that this medication goes by multiple names. Gabapentin is the generic name and Neurontin, Gerlis, and Horizon are the brand names. What you'll see is that providers will use these names interchangeably when talking about this medication, so don't get confused. So fact number 1 that I want you to know about is how this medication works. Gabapentin is considered to be an anticonvulsant, and its mechanism of action is somewhat complex, but the main takeaway is that it works by blocking voltage-gated calcium channels, and this helps calm down the neurons that become too excited. What we see is that this medication is structurally similar to GABA, which is the neurotransmitter that benzodiazepines work on, right? However, gabapentin doesn't bind to the GABA receptors like the benzos do. Fact number 2 that you need to know about is what gabapentin is used to treat. So something that's really interesting about this medication is that less than 1% of scripts are written for conditions that it's actually FDA approved for. Most of its use is off-label and a huge amount of those prescriptions are for psychiatric conditions. So the 3 conditions that gabapentin is actually FDA approved to treat are post-herpetic neuralgia, seizures, and restless leg syndrome. However, off-label uses include things such as anxiety, chronic pain, bipolar disorder, insomnia, alcohol use disorder, and akathisia. The list really goes on, but these are the main conditions to know about. Fact number 3 to know about is how this medication is prescribed. So gabapentin comes in capsules, tablets, and an oral solution, and dosing is very variable. If you're on the immediate release version, the usual dose range is between 900 to 1800 milligrams in 3 divided doses, and the max recommended dose is 3600 milligrams per day. So if I'm going to start someone on this medication off-label for anxiety, my general approach is to start at around 100 milligrams at bedtime with the plan of gradually increasing the doses tolerated to 300 milligrams 3 times per day. And it doesn't matter if you take this medication with or without food because the absorption isn't significantly affected. However, something to know about is that if you're taking an antacid containing aluminum and magnesium, such as Maalox, you should wait at least 2 hours to take the gabapentin because Maalox can reduce gabapentin's concentration by about 20%. And whenever starting this medication, my goal is to find the lowest effective dose that results in complete remission of symptoms. And then don't forget, it could take several weeks for this medication to build up in your system to be effective. Fact number 4 that I want you to be aware of are the side effects. According to the FDA label, the most commonly reported side effects in those who were taking this medication for epilepsy included somnolence, dizziness, ataxia, fatigue, and nystagmus. Now, there are some big hitter side effects with gabapentin that I need you to know about. This medication can 1. Lead to multi-organ hypersensitivity. So tell your provider if after taking this, you start to experience fevers, rashes, or lymph node enlargement. 2. Cause anaphylaxis and angioedema. Therefore, if you were to take this and started having difficulties breathing, or if you notice swelling of your lips, tongue, or throat, you'd want to seek out emergency treatment. 3. Lead to impairments when driving. So be careful if you're taking this and deciding whether or not to operate your vehicle. 4. Increase the risk of suicidal thoughts or behaviors. Pooled analyses of 199 placebo-controlled clinical trials of anti-epileptic drugs showed that patients receiving these medications were approximately twice the risk of suicidal thinking or behavior compared to patients randomized to placebo. And 5. Cause neuropsychiatric adverse reactions in pediatric patients aged 3 to 12 years. Researchers found that children who were taking these medications for epilepsy experienced things such as emotional lability, hostility, and thought disorders, which mainly presented with concentration difficulties at school and hyperkinesia, which is basically a restlessness or hyperactivity. Now, fact number 5 I want you to know about is that gabapentin should be gradually tapered and discontinued. The reason behind this is that coming off the medication too quickly, especially if you're someone who's been on high doses for long periods of time, puts you at increased risk for withdrawal symptoms. The most common adverse reactions reported from abrupt discontinuation of gabapentin include anxiety, insomnia, nausea, pain, and sweating. The main concern, though, is that this medication can increase seizure frequency if stopped too quickly, and this is mainly seen in those who are taking it for epilepsy. So make sure to talk to your doctor before coming off of this medication. Now, if you're looking to learn more about gabapentin, make sure to click that top video.